What is the position for enema? Enema position on the left lateral with the right knee flexed. Okay. The position for enema is what? Left lateral with the right knee flexed. Left lateral with the right knee flexed. What is the other name of lateral? Lateral is also called Sims or semi-prone. If you don't know, you write. Okay. Lateral is equal to Sims, S-I-M-S. Sims or semi-prone. Okay. Sims or semi-prone. Lateral is also called Sims or semi-prone. For example, what is the position for enema if you get a question? Either left lateral with right knee flexed, or left semi-prone with right knee flexed, or left Sims with right knee flexed. This may be the answer. So always you want to know the synonyms of what? Lateral. Lateral is also called Sims, S-I-M-S. Sims or semi-prone. Okay. Next, how long you will insert the enema catheter? This is the most repeated question. It is 3 to 4 inches or 6.6 to 8.8 centimeter. 3 to 4 inches or 6.6 to 8.8 centimeter. Okay. So this is the most repeated question. Next question we will discuss. Most of the gynecological procedures are done under which position? Gynecological procedures are done under which position? It is always lithotomy position. Lithotomy already you know. What is lithotomy? I'll just show you. I'll just draw it. Okay. In between, if you have any doubt, you can note it down and you can ask after the class. Okay. See, this will be the lithotomy position. Okay. We want to spread the leg like this. Okay. This is lithotomy position. Most of the gynecological procedures are done under lithotomy position. For example, a pregnant woman is scheduled for Fern test. Okay. A pregnant woman is scheduled for Fern test. Scheduled for Fern test. F-E-R-N. Fern test. The pregnant woman is scheduled for Fern test. What position will be best? What position will be best during this procedure? What position will be best during this procedure? So you don't know what is Fern test. Even though you don't know what is Fern test, you want to remember it's a pregnant woman. Most of the gynecological procedure done are lithotomy. Actually, Fern test is the test to detect amniotic fluid leakage. Okay, that we'll discuss in gynec. Okay. So most of the gynecological procedures done under lithotomy position. Next one, after thyroidectomy. What is the position after thyroidectomy? It is always semi-phallus position. Why we are providing semi-phallus position? It is to reduce the edema, swelling organa. It is to reduce edema of the throat. Okay, edema of throat, throatless swelling organa. Now, after thyroidectomy, if you keep supine position, what will happen? Edema will increase, the respiratory distress occurs, the patient may go for respiratory arrest. So that is the reason semi-phallus position to reduce the edema of the throat. Okay. But after tonsillectomy, what is the position? Do you know what is the position after tonsillectomy? This lateral. Lateral or side-lying position. Okay. After tonsillectomy, lateral or side-lying position. Lateral or side-lying position. See, whenever you get this question, sometimes you may be confused. After thyroidectomy, after tonsillectomy, both look like same. How to remember this? Tonsillectomy, L for lateral. Tonsillectomy is having L letter. L round it. Just round it, everyone. Tonsillectomy, L for what? Lateral. Lateral or side-lying position. Tonsillectomy, L for lateral or side-lying. Okay. How you will be able to know patient is having bleeding after tonsillectomy? How you will be able to know patient is having bleeding after tonsillectomy?
Patient swallowing frequently.
Frequent swallowing, very good. Frequent swallowing after tonsillectomy indicates what? Bleeding. Okay. Patient frequent swallowing. We can just analyze here. Okay. So frequent swallowing after tonsillectomy equal to what? Bleeding. Okay. Frequent swallowing after tonsillectomy equal bleeding. When you can suspect the bleeding, whenever you suspect the bleeding, what should be the initial assessment? Assess the vitals. Vitals. Okay. You always want to assess the vitals of the client. In vitals, what you can see? Any bleeding related disorders, what vitals you can see? Low BP, just right. Bleeding equal to, bleeding vitals, you write, bleeding equal to low BP, increase pulse, pallor. Low BP, increase pulse, there you write, thready, THREADY, thready. Increase pulse, thready, THREADY. Increase pulse, what type of pulse you can notice? Thready pulse. Thready or feeble, FVFWBLE. Thready or feeble. Then pallor, PALLOR, pallor. Thready or feeble, pallor, PALLOR, pallor. Okay. So what type of pulse you can notice? Thready or feeble, then pallor. Low BP, increased pulse, pallor. Okay. So these are the points. So next we will discuss about uh, so to prevent aspiration only we are keeping lateral position. Okay. Always you want to know, to prevent aspiration, the best position is always lateral or sideline position, not only after tonsillectomy. If any patient is at high risk of aspiration, always give lateral or sideline position. For example, a semi-conscious patient vomited. What position you want to give? Lateral position. Immediately you want to give lateral position. Okay, it's a previous question. An unconscious patient requires mouth care. What position you will give? It's a previous question. Unconscious patient mouth care or you cannot keep supine or semi follows. You want to keep lateral only. Okay, these all patients not having what gag reflex, swallowing reflex. So these all cases you want to keep the patient in lateral or sideline position. Okay, is that clear, everyone? This one after hemorrhoidectomy. What is the position? What is the position after hemorrhoidectomy? It is sideline position, sideline or prone position. Why you are keeping sideline or prone position? Because sideline or prone position, it will help to prevent bleeding. Bleeding prevent the sideline or prone position to prevent bleeding. After hemorrhoidectomy, during the first 24 hours, what would be the best intervention? Ice pack application. You just write first 24 hours. First 24 hours after hemorrhoidectomy, best intervention is ice pack application. Ice pack. Why ice pack? Always, if you get any question, surgery related question, okay? You get any surgery related question, first 24 hours, if you get a time frame, always think about bleeding. How you can stop the bleeding after hemorrhoidectomy? Ice pack. What is the specialty of ice? Ice is a vasoconstrictor. Vasoconstrictor. Vessels constrict and help you. So that is the reason it will stop the bleeding. So after hemorrhoidectomy, first 24 hours, ice pack application to stop the bleeding. But after 24 hours, it is at most important to keep what? Sitz bath. After 24 hours, everyone switch on the video during this session, okay? After 24 hours, you want to promote sitz bath. SIT is it? Sitz bath. Why we are promoting sitz bath after 24 hours? What is the purpose of promoting sitz bath after 24 hours? It is to promote healing. Healing promotion. Okay, healing. Okay. So after hemorrhoidectomy, after 24 hours, it is at most important to keep sitz bath. Okay, to promote healing promotion. Okay. So next we'll discuss about uh, after hip replacement. What is the position after hip replacement? After hip replacement, you want to place the patient in supine only, but you want to abduct the leg. What do you mean by abduction? ABDUCTION. Abduction. Abduction means what? Away from the body like this. Okay. Imagine this is a leg. In between the leg, you want to keep what? Pillow. So abduction of legs by keeping pillow in between the legs. In between the legs, we want to keep what? Pillow. Pillow. So why we are abducting the legs? Then only hip joints will be safely placed into the socket. If you try to adduct, there's a chance for dislocation. So you should not adduct. What you want to do? Abduct. ABDUCT. Okay. So after hip replacement, it is at most important to what? Abduct the legs. Abduction, not adduction. Okay. Adduction or abduction vyathyasam. This is what? Abduction. This is adduction. Adduction, you want to remember add. Add means cherka. Okay. Add. Okay. Abduction means away from the body. Adduction means towards the body. Okay. After hip replacement, what do you want to maintain? abduction of legs by keeping pillow in between the legs to prevent dislocation. And what all are the other important interventions you want to perform after hip replacement? You want to advise the patient do not cross the legs. After hip replacement, what will happen if they cross the legs? There's a chance for developing hip dislocation. Do not cross the legs and do not lie on the affected side. Do not cross the legs and do not lie on the affected side. For example, the patient had undergone right hip replacement. So they can keep supine or left lateral. They cannot keep what? Right lateral position. Okay. If the patient have undergone right hip replacement, you should never place them on right lateral. Okay. So you should not keep the patient on affected side. Okay. So avoid affected side always. So do not cross the legs. And after hip replacement, it is at most important to keep elastic stockings on the unaffected side. You write this point, okay? Place the elastic stockings on the unaffected extremity. Place the elastic stockings on the unaffected extremity. Place the elastic stockings on the unaffected extremity so as to increase the venous return. So as to increase the venous return. So as to increase the venous return, thereby preventing DVT. Thereby preventing DVT. Okay. So why we are keeping elastic stockings? To increase venous return. Not only after hip replacement, okay. If after any surgery, if the patient requires bed rest, prolonged bed rest, we want to keep elastic stockings. Okay, what all surgeries requires more bed rest? Below umbilicus, if you do any surgery below umbilicus, the bed rest requires more when compared to other surgeries. LSCS, pelvic excenteration, pelvic surgeries, hip replacement. These all cases, bed rest requires more. Okay, hip replacement. These all cases, bed rest requires more. So there's a chance for developing what DVT. So that is the reason we want to keep what elastic stockings. Okay, it will help to increase what venous return. Okay, thereby preventing deep vein thrombosis. Okay, next topic we'll discuss after mastectomy. Okay, you don't need to write every points. Okay, because it's in your book. Okay? I'll share you the notebook. Whenever I am telling you to write it, then only you write. Otherwise, you just listen. Okay, I'll share you the note. Just listen. Okay. So you will not be getting time to write. Crash course, there is no time to write. Just listen. Okay, everyone. Okay. I'll share you the notes. Just listen very carefully. If you want to write, you can write running notes. Running notes is the okay. Why I am telling when you are writing something, you will be missing the actions. 60% you will grasp through the actions. Actions grasp. If you are goes on writing, you will not get that actions. Okay, so always concentrate on the class. Don't write anything. If you want, you can write lecture notes. Okay, ചുമ്മാ എഴുതി വെക്കാം scribble ചെയ്യാം. Okay, I'll share you the notes. Don't worry. Okay, so just listen. So now after mastectomy, what is the position after mastectomy? After mastectomy, you want to place the patient in semi-follows position. Semi-follows position with the affected extremity elevated with the pillow. For example, the patient have undergone right mastectomy. After right mastectomy, semi follows with the right arm elevated with the pillow. Right arm elevated with pillow to prevent lymph edema. Why we are elevating that area? Mastectomy can be only performed with what? Lymph node dissection. Okay, axillary lymph node also will be removed. Okay, during mastectomy. So after mastectomy, you can always expect what swelling on axillary area. So that is the reason we want to keep what semi-follows with the affected extremity elevated with the pillow. Okay, this is the point. Head and elevation 30 to 45 degrees called semi-follows. Head and elevation 30 to 45 degrees with the affected extremity elevated with the pillow. Okay, if it is left mastectomy, semi follows with the left arm elevated with the pillow to prevent lymph edema. Lymph edema prevent. Okay. So after mastectomy, what all are the other main interventions? Mastectomy, very, very important topic, and they have asked numerous questions from this. Okay. So just listen. What exercise you can recommend after mastectomy? First 24 hours. If they are asking first 24 hours, just finger movement exercise. Yeah, finger move ചെയ്താൽ മതി. Just. Okay. First 24 hours after mastectomy, what is the exercise? Finger movement exercise. But after 24 hours, it is at most important to do what? What exercise it is? Floor exercise. Floor exercise or walking fingers against the floor or climbing fingers against the floor. Why we are promoting this? It will prevent what? Edema. Edema korkana. So after mastectomy, first 24 hours finger movement exercise. Next 24 hours, what it is? Floor exercise or walking fingers against the floor or climbing fingers against the floor. Same only. Okay. So after mastectomy, the other important thing is a diet. What diet you can recommend after mastectomy? After mastectomy, it is at most important to keep what? Low salt diet. Because after mastectomy, as I already told that there is a chance for developing edema of the axillary region. If any patient is at a risk of developing edema, always salt restricted. What will happen if you take more salt? Salt can lead to fluid retention in the body. So we cannot give salt. Not only after mastectomy, if any person is at high risk of developing edema, always salt restricted diet. Okay. For example, heart failure, liver failure, renal failure. These all cases, what you want to keep? Salt restricted. Okay. Edema patient. The patient who is at risk of edema, salt restricted. So after mastectomy, other important concern is that there is a chance for reoccurrence of cancer. Okay. If we have undergone, if we have done right mastectomy, there is a chance for developing left breast cancer, reoccurrence now. So most probably reoccurrence occurs because of increased estrogen level. Okay. So that is the reason the doctors usually advise the patient to take anti-estrogen pills, such as tamoxifen citrate. I'll write it. Okay. What is the medication? Tamoxifen citrate should be taken after mastectomy during the first 5 years. Okay, I'll just write here. Tamoxifen citrate, the action is what? Anti-estrogen. Anti-estrogen. It will always help to decrease the estrogen level in the body. Okay, one of the main risk factors of breast cancer is what? Increased estrogen. Whenever estrogen is very high, there's a high risk of developing what? Breast cancer. So after mastectomy, we want to keep the patient on tamoxifen citrate. Okay. Some patients, breast cancer reoccurrence occurs because of increased estrogen. But don't think that this uh, anti-estrogen will definitely prevent a reoccurrence. Okay. Don't think like that. Okay. For a precaution, doctor may advise the patient to take this. But even though they are taking this medicine, some people may get reoccurrence. Because don't think the only risk factor is what increases estrogen for breast cancer. There are various risk factors for breast cancer, right? What all are the risk factors for breast cancer? Age, 40 years above, obesity, radiation exposure, BRCA1, BRCA2 gene mutation, genetic mutation, genetic history, family history. Okay. There are various premenstruation, post-menopause. There are various what risk factors for breast cancer. One of the risk factors is what? Increased estrogen. Okay. If it is due to that, if breast cancer occur, this will help you to prevent, will help the patient to prevent what? Reoccurrence of that tumor. Okay. So after mastectomy, the other important concern is that patient will not accept that, right? Altered body image. Patient will not accept that altered body image. So as a nurse or a doctor, what is our goal? What is our goal? The patient should accept their altered body image. What is the goal after mastectomy? Patient should accept their altered body image. Okay, not only after mastectomy. Okay, if any external body part is removed, the goal is same. You understood? If any external body part is removed, what is a nurse goal? The patient should accept their altered body image. After right arm amputation, what is the goal? You tell me. Patient should accept their altered body image. After right leg amputation, what is the goal? Patient should accept their altered body image. If any external body part is removed, the goal is same one. Okay, is that clear? So, instruction following mastectomy. I'll share you some notes regarding this. Okay, instruction following mastectomy. You want to read it? Okay. Regular batch already I shared 2 days before, I think, when we discussed the oncology. Okay. So I am sharing this in group. Okay. Please go through that. Okay. There are many other instructions after mastectomy. You want to read it? Okay. I shared it. Okay. What are the other instructions? You should not check BP on the affected side, avoid injury on the affected side. This kind of instruction, you read it. Okay. So next we'll discuss um, after vitrectomy. After vitrectomy, what is the position after vitrectomy? Vitrectomy, why we are doing vitrectomy? Vitrectomy എന്താണ്? Removal of vitreous fluid. Removal of vitreous fluid is called what? Vitrectomy. It is eye surgery. Vitrectomy is an eye surgery. Why we are removing vitreous fluid? Inside our eye, if vitreous fluid is very high, intraocular pressure will be increased. Once the intraocular pressure is very high, this can result in retinal detachment. Retina separate. Okay. So the main cause for retinal detachment is what? Increased vitreous fluid. So if any patient is diagnosed with a retinal detachment, what surgery we may perform? Vitrectomy. Retinal detachment main cause is increased vitreous fluid inside the eye. Increased vitreous fluid inside the eye is the main cause for what? Retinal detachment. So what is the surgery? Vitrectomy. How you'll get a question? A 42-year-old patient is diagnosed with a retinal detachment. What surgery the doctor may prefer for this patient? What is the surgery? That is vitrectomy. So vitrectomy. So after vitrectomy, what position you want to maintain? It is prone position. Prone ആണ്. See, prone position, what is prone position? You want to lie down like this. But you want to advise the patient to interlock the hands like this, and they want to lie down like this. Okay. So this is what? Prone position. Prone position with a eye shield on the affected eye. Eye shield വെക്കണം. Eye shield on the affected eye. If the patient have undergone right vitrectomy, you want to keep what? Right eye shield. Okay. So what is the position after vitrectomy? Prone ആണ്. Prone. Prone. What is the other name of prone position? What is the other name of prone position? Anyone knows?
Lying back.
Lying on stomach. Lying back. Lying on back is supine. Okay. Lying on stomach. ലൈയിങ് ഓൺ സ്റ്റൊമക്കിനെയാണ് പ്രോൺ പൊസിഷൻ എന്ന് പറയുന്നത്. ലൈയിങ് ഓൺ സ്റ്റൊമക്ക് അല്ലെ, കമന്ന് കിടക്കുമ്പം നമ്മുടെ സ്റ്റൊമക്ക് അല്ലേ, വി ആർ പ്ലേസിങ് ലൈക്ക് ദിസ്, റൈറ്റ്? സോ ലൈയിങ് ഓൺ സ്റ്റൊമക്ക് ഈസ് വാട്ട്? പ്രോൺ പൊസിഷൻ. പ്രോൺ, PRONE. So don't think after any other eye surgery you want to keep prone position. No, only after vitrectomy. Except vitrectomy, if you have done any other eye surgery, you want to keep the patient in semi-follows position to decrease intraocular pressure. Just write this point. Except vitrectomy, except EHCPT. Okay, except vitrectomy, after any other eye surgery, except vitrectomy, after any other eye surgery, semi-follows position to decrease the intraocular pressure. To decrease the intraocular pressure. So what is the meaning apart from vitrectomy? If you have done any surgery if you have done any eye surgery apart from vitrectomy, you want to keep that patient in what semi-follows position to decrease what intraocular pressure. Okay. So what is the normal IOP? Normal IOP എന്താണ്? What is the normal IOP?
10 into 21.
That is in normal IOP, 10 to 21. Okay. How to remember IOP? Imagine IO as a 10 and double it. Okay. IOP. You want to imagine IO as a 10. You want to just double it. Almost doubling, no? 10 to 21 M of H. And IOP is always measured by using tonometry. Tonometry is the instrument to measure what? Intraocular pressure. Okay. So now we'll discuss about renal biopsy next topic. What is the position for renal biopsy? During renal biopsy, you want to place the patient in which position? During renal biopsy. Tell me now.
Prone position.
During renal biopsy, what position you want to maintain? Prone
Supine
position. You just write. It is not in your book. You write, okay. Renal biopsy book illa. You just write renal biopsy underline. Renal biopsy. So during renal biopsy, prone position. Okay. During renal biopsy, prone position. Next, after renal biopsy, supine position. After renal biopsy, supine position. Supine position. After renal biopsy, there's a chance for heavy bleeding. Okay. So you want to closely monitor the signs of bleeding. Complication, expect for bleeding. Expect for bleeding after renal biopsy. Expect for bleeding after renal biopsy. So what are the vitals? Tell me now. How you know patients are bleeding? Low BP, increased pulse, pallor. If you see these vitals, definitely it is bleeding. Okay. So that's a point. So you just write one point. Okay. Low BP, increased pulse, pallor. Underline it. Okay. Low BP, increased pulse, pallor. Low BP, increased pulse, pallor. Low BP, increased pulse, pallor. Underline this and below that first point, right? After surgery. After surgery, if you see this vital, what it is? Bleeding. Okay. After spinal procedure, if you see these vitals, that is what? CSF leakage. After vomiting, diarrhea. Vomiting and diarrhea. If you see these vitals, this is dehydration or hypovolemia. Hypovolemia or dehydration. Okay, I hope everyone understood this, right? So now next one, liver biopsy. Okay, it's in your book, no need to write, just listen. Liver biopsy, where the liver biopsy will be done? Where the liver is located, right turn. Okay, here, right upper quadrant. So while doing liver biopsy, what position you want to maintain? Is that most important to maintain what position? Supine with the right arm extended towards left shoulder. Supine only, but right arm extended towards left shoulder. Why we are extending towards the left shoulder? To promote maximal exposure of liver. Liver maximum exposure. So what will happen? If you do like this, supine with right arm extended towards left shoulder, it will help to promote maximal exposure of liver. Liver maximum exposure. Okay, that is the best position. Okay, supine with the right arm extended towards left shoulder. But after liver biopsy, it is at most important to keep what? Right lateral. You want to keep what? Right lateral position with a small sandbag kept under the punctured site. Right lateral with a small sandbag kept under the punctured site. Punctured site in the under. It is to prevent what? Bleeding. Bleeding prevent. Okay. So after liver biopsy, what is the position? Right lateral. But during liver biopsy, supine position. Supine with the right arm extended towards left shoulder. Why we are promoting this? To promote maximal exposure of liver. But after liver biopsy, right lateral. And you know what are the complications after liver biopsy? Bleeding of bile. Okay. What is the main complication after liver biopsy? Bleeding of bile. Okay. BB noga. BB. Okay. Liver is the organ which produces bile. Okay. When we prick with a large needle, when we withdraw it, what will happen? Bile will leak out. Bile will leak out. Okay. So bleeding of bile is the complication after liver biopsy. Okay. Bleeding of bile is the complication after liver biopsy. Is that clear, everyone? BB. Okay. So before any biopsy, you write this point. Before any biopsy, coagulation profile should be initially assessed. Coagulation profile should be initially assessed. Before any biopsy, coagulation profile should be initially assessed. Coagulation profile should be initially assessed. Coagulation profile should be initially assessed. Initially assessed, coagulation profile. Okay. If coagulation profile is abnormal, okay, that means BT, CT is abnormal, we cannot do biopsy. Okay. What will happen if the patient is having prolonged bleeding time and all? It can lead to what? Heavy bleeding and hypovolemic shock. Okay. So before any biopsy, what should be initially assessed? Coagulation profile. Okay. Next, we will discuss about lumbar puncture. Okay. Next topic. LP. Lumbar puncture. What is the position for lumbar puncture? Before discussing the position, what is the other name of lumbar puncture? Lumbar puncture is also called dash.
Spinal tap.
Spinal tap. Okay. The other name of lumbar puncture is equal to spinal tap. Spinal tap. So what is the position where we will do lumbar puncture? What site you want to perform lumbar puncture? L3, L4. In between L3, L4 you want to prick. Okay. Site to L3, L4. What position? C shape.
C shape.
C shape or knee chest position. C shape or knee chest position. C shape or knee chest position. C shape, knee chest, or one more, fetal position. In womb, how the fetus is this shape, C shape or knee chest or fetal position. This is the best position for what? Lumbar puncture. But after lumbar puncture, you want to maintain flat position. After lumbar puncture, flat position. See, after spine related procedures, there's a chance for two complications. One is spinal headache and secondly hypotension. What are the two complications associated with the spine related procedure? Spinal headache and hypotension. What is spinal headache, you tell me? After any spine related procedure, there's a chance for CSF leakage. Due to CSF leakage, the body becomes severely dehydrated and the patient may get headache. This is considered to be spinal headache. What headache? Spinal headache means what? Due to that procedure only this happens. Headache happens. So that is the reason spinal headache. What are the two complications after spine related procedure? Spinal headache, hypotension, BP correct. Okay. 2H you want to remember. headache, hypotension. So what are the interventions to overcome this? Fluid flat position. Fluid flat position. You just write after any spine related procedure. After any spine related procedure, remember 2H and 2F. Remember 2H and 2F. What are the 2H and 2F? You tell me. 2H and again. Headache, hypotension, and 2F are fluid flat position. Fluid flat position. Okay, very important. Okay, what are the other important intervention after spine related procedure? Check the sensation of the lower extremity. Very important. Not no. After any spine related procedure, check the sensation of the lower extremities. After any spine related procedure, check the sensation of the lower extremities. After any spine related procedure, check the sensation of the lower extremities. Okay. Next, we will discuss this topic after lower knee amputation. Okay, below knee amputation. After below knee amputation, what are the steps you want to take? Okay, first 24 hours after below knee amputation, what you want to do? First 24 hours after below knee amputation, stump elevation. Okay, stump elevation. It's in your book. Okay, on it right. After below knee amputation, first 24 hours, what you want to do? Stump elevation. What do you mean by stump? STUMP. Stump. Stump is also called what? Residual limb. Residual limb. See, after cutting the remaining portion is called what? Stump or residual limb. Okay, so after below knee amputation, what you want to do? Stump should be elevated with what? Pillow. Pillow is stump elevation. Why we are promoting stump elevation? Stump elevation it is to prevent edema. Edema prevent here. Okay, stump elevation. Why we are promoting stump elevation? It is to prevent edema. Edema prevent here. Okay, so always first 24 hours after amputation, lower knee amputation is what? Stump elevation. But after 24 hours, what do you want to do? Intermittently provide prone position. Okay, intermittently. It is not in your book, you write. After amputation, after 24 hours, after amputation, after 24 hours, intermittently provide prone position. Intermittently provide prone position to prevent muscle contractures. To prevent muscle contractures. Intermittently provide prone position to prevent muscle contractures. Muscle contractures to prevent here. First 24 hours, why we are elevating stump? To prevent edema. Okay, but after 24 hours, intermittently you want to provide what? Prone position to prevent what? Muscle contractures. Muscle contractures prevent here. So after amputation, very important thing, after amputation, there's a chance for developing phantom limb sensation. What sensation? Phantom limb sensation. What do you mean by phantom limb sensation? You already know what is phantom limb sensation. Since many years, we are using our extremities for various activities, right? Suddenly, if it is removed, imagine my right arm is amputated. Even though after removal of right arm, still I feel that arm is existed. That false sensation is called phantom limb sensation. So what is phantom limb sensation? It is a false sensation which is felt by the client after amputation. For example, after right arm amputation, if I report you right arm itching report, it is what? Phantom limb sensation. Is it clear? So Of what is phantom limb sensation? It's a false sensation which is felt by the client after amputation. Okay. So regarding phantom limb sensation, they have asked many questions. Okay. After right below knee amputation, patient reported right foot itching. What should be the best nursing response? What should be the best nursing response? What you want to tell? You want to tell it is expected, it is a phantom limb sensation. What you want to tell? It is expected, it is a phantom limb sensation. Okay. Or the other way, what is the expected outcome after phantom of amputation of the lower extremity? What is the expected outcome after below knee amputation or above knee amputation? Expected outcome. What is the expected outcome after amputation? No, there may be relief in incisional pain, but will have intense phantom limb sensation. Pain may be relieved, but there will be what? Intense phantom limb sensation. This point you write. After amputation, expected outcome. After amputation, expected outcome. You just write. After amputation, expected outcome. Expected outcome. There may be relief in incisional pain. There may be relief in incisional pain, but will have intense phantom limb sensation. There may be relief in incisional pain, but will have intense phantom limb sensation. There may be relief in incisional pain, but will have intense phantom limb sensation. That is what expected outcome. Okay, expected outcome after amputation. Okay,
Sir,
how
one
to prevent? There may be relief in incisional pain, but will have intense phantom limb sensation. Okay, so next one, how to prevent phantom limb sensation? How you can prevent phantom limb sensation? You know, the best way to prevent phantom limb sensation is what? Assist in grief process. Grievance or grief process. What is grievance or grief process? In nursing, you have studied what is grief process: denial, anger, bargain, depression, acceptance. These steps: denial, anger, bargain, depression, acceptance. These steps togetherly termed as what? Grief process. Okay. So, how it will prevent phantom limb sensation? What is grief process? Actually, what is grief process? You know, tell me. No,
Lambda.
what is grief? That I know. What is grief process? If you lose any valuable object, you cannot accept it suddenly, right? For example, if you lose your phone, recently you purchased one phone, suddenly it is lost. Can you accept it? How you'll react? You tell me. You are traveling through bus, suddenly lost your recently purchased iPhone 15. Okay, imagine. So how you'll react? First thing in denial. This is what denial. Denial means what? Not accepting that painful reality. What is denial? Not accepting the painful reality. Secondly, you will feel anger towards the passengers. അടുത്തുള്ളവനൊക്കെ നോക്കി പഠിക്കുന്നു അല്ലെ? Anger ഭയങ്കരം. Thirdly, you will bargain it. Okay, please, if you get my phone, please give it back. It is what bargaining. Then you will be depressed. Then you will accept. What you are accepting? Your phone is lost. You will not accept it suddenly. If you lose any valuable object, you will not accept it suddenly. How you will accept? First the denial, then anger, then bargain, then depression, then acceptance. The same thing occurs only after amputation. After amputation, you cannot suddenly accept your part is lost. That is denial. Secondly, you will feel anger towards God. Thirdly, you will bargain for your limb. Last, depression, then you will accept. So once you accept that reality, you will not be having what? Phantom limb sensation. So assist in what? Grief process after amputation to prevent phantom limb sensation. So what is grief process, you tell me? It's a psychological process of our mind after any loss. Okay. We cannot accept anything, what we cannot accept what if we lose any valuable object suddenly, right? We will accept very slowly only. Denial, anger, bargain, depression, acceptance. This stuff is very important, dabda. Okay. So they have asked this question another way. According to Dr. Elizabeth Kubler-Ross, grief process in which order? According to Dr. Elizabeth Kubler-Ross, grief process in which order? Okay, doctor പേര് കേട്ട് പേടിക്കണ്ട. It is very simple question. According to Dr. Elizabeth Kubler-Ross, grief process in which order? You tell me. Denial, anger, bargain, depression, acceptance. DABDA. Okay, DABDA. DABDA is the code you want to remember. Okay. Now we'll discuss after amputation. Next aim is what? We want to keep the patient artificial limb. You want to keep what? Artificial limb. So how you want to keep artificial limb? You want to first mold the residual limb into cylindrical shape. What you want to do?
POP. We can
Mm.
use POP.
First, not POP. Just listen. First, you want to mold the residual limb into cylindrical shape by keeping shrinkage device. We cannot directly insert the residual limb into artificial limb. You want to mold the residual limb into what shape? Cylindrical shape. How you want to achieve cylindrical shape? You want to apply shrinkage device over there. What device is applied after amputation? Shrinkage device is applied after amputation to mold the residual limb into cylindrical shape. Then only it will fit into artificial limb. So shrinkage device is applied after amputation to achieve what shape? Cylindrical shape. Okay, cylindrical shape achieve. So this is the next step. Okay, so these are the important points regarding what? After amputation. Okay, so next topic we'll discuss about transmission based precautions. Next topic on transmission. Sorry, before transmission based precaution, I want to discuss DVT. Okay, very important point. DVT position and all. Okay, before discussing DVT position, first you want to tell what is DVT. Okay, we'll discuss more about DVT. Okay, so DVT means what? For from the name itself, deep vein thrombosis. Deep vein thrombosis means what? There is a clot inside the vein. Okay, thrombosis, the word meaning is clot. Deep vein thrombosis means what? Inside the vein, there are some clot accumulation. Okay, so what is the main cause for DVT? Is it prolonged standing or immobilization? What is the main cause for DVT? Prolonged standing or immobilization? What is the main cause?
Prolonged
Mobilization.
Prolonged.
Mobilization. Long standing.
Immobilization. It is not prolonged standing. Prolonged standing can lead to varicose vein
Varicose vein.
mainly. Varicose vein. Okay. Prolonged standing can lead to what? Varicose vein. Okay. But immobilization is the main cause for DVT. How immobilization can lead to DVT? So you want to know the mechanism. Just listen, everyone. Once the heart pumps, just listen. Once the heart pumps through arch of aorta, the circulation will be supplied towards the lower extremities through abdominal aorta. Through abdominal aorta, it goes through the lower areas through iliac artery, femoral artery, popliteal artery, dorsalis, pedis arteries. What I mean to say is that through various arteries only you will receive the circulation in your leg. Through various arteries only the circulation reaches in your foot. But from there it returns through various veins. Vein-looda return on. You understood? Through various arteries only the circulation reaches in your foot, but from there it returns through what? Various veins. Return ആവുന്നത് വെയിനിലൂടെ. This is called venous return. If you walk on a daily basis, what will happen? Arterial perfusion will increase. Moreover, venous return also will be there. But if you are not at all walking, if you are bedridden, what will happen? You tell me. The arterial perfusion, the perfusion to the arteries will be decreased. Moreover, the venous return also will be decreased. So there's a chance for clot formation, that is DVT. Especially when you are bedridden, calf muscle area vein, it will be compressed, compression. So this compression can lead to what? Clot formation. This is what we call as venous congestion or venous stasis. Vein congestion type of venous congestion or venous stasis. Stasis means no flow. The main cause for DVT is venous stasis or venous congestion due to immobilization. What is the main cause for DVT? Venous stasis, STASIS, venous stasis or venous congestion due to immobilization. Main cause for DVT is what? Venous stasis or venous congestion due to immobilization. Venous stasis. You write this point, okay? The main cause for DVT is venous stasis, 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 or venous congestion. Venous congestion due to immobilization. Main cause for DVT is venous stasis or venous congestion due to immobilization. Okay. Do you want to switch on the video? Do you want me to remove you all? Those who are not switching on video, I'll remove you all. Remove it now. On the video now. Okay. So you understood what is the main cause for DVT? So, when you can suspect the patients having DVT? As a nurse, when you will suspect the patients having DVT? If I am a patient, okay, what complaint I want to tell you? You tell me now. What complaint I want to tell you? Very good.
Calf just pain.
Calf muscle pain. Okay. Whether every calf muscle pain is DVT? No. Don't think every calf muscle pain is DVT. If any immobilized patient complains of calf muscle pain, then only you can suspect DVT. If any immobilized patient complains of calf muscle pain, you can suspect what? Patients having DVT. If any immobilized patient complains of calf muscle pain, the initial assessment should be assessment of Homan sign. If any immobilized patient complains of calf muscle pain, what you want to initially assess? Assess the signs of Homan sign. Assess the signs of Homan sign. Homan sign assessment. What is Homan sign?
Wild doors.
HOMAN. Homan sign. Imagine this is a leg. Okay.
Severe calf muscle pain.
This is a calf muscle. So what you want to do in Homan sign? You want to dorsiflex the foot. Okay. Flexing the foot backward, this towards your face. You flex your foot like this. This is called as dorsiflexion. When you dorsiflex the foot, if there is severe calf muscle pain, then Homan sign is positive. Homan sign and the positive one. No calf muscle pain. Homan sign is negative. When you dorsiflex the foot, if there is a severe calf muscle pain, Homan sign is positive. No calf muscle pain, Homan sign is negative. That's a point. Okay. So how you will get question? For example, you write one question, okay? After LSCS on the seventh day, patient complains of severe calf muscle pain. After LSCS on the seventh day, patient complains of severe calf muscle pain. What should be the initial assessment? What should be the initial assessment? What is the initial assessment? Assess for Homan sign. Assess the Homan sign. So if any immobilized patient complains of calf muscle pain, what is the first assessment? Homan sign assessment. Is it clear? Okay, immobilized patient means bedridden patient after any surgery. Okay, after any surgeries like after pelvic excenteration, after hip replacement. If after these all cases, if the patient reported calf muscle pain, what you want to initially assess as a nurse? Assess the signs of Homan sign. Assess the Homan sign. If Homan sign is positive, then what is the next test? Venous Doppler or D-dimer test. That is a confirmatory test. So what is the confirmatory test for DVT? Venous Doppler or D-dimer test. Non-confirmatory test. Venous Doppler or D-dimer test. So what is the life-threatening complication of DVT? Life-threatening complication of DVT is pulmonary embolism. What is the life-threatening complication of DVT? P, pulmonary embolism. So when you can suspect the patients having pulmonary embolism? Tell me now. എപ്പോഴാണ് suspect ചെയ്യുക? What history they want
Chest
to
pain.
show? Very good, chest pain. So you see here, if any person with a clot history, okay, what history? Clot history, suddenly complains of chest pain, then you can suspect P. You just write this point. Clot history plus chest pain equal to P. Clot history plus chest pain equal to P. Clot history plus chest pain equal to P. Clot history plus chest pain equal to pulmonary embolism. Clot history plus chest pain equal to P. Okay. If you see any clot history in the question, and thereafter the question reveals chest pain. For example, you write one question. A patient is recently diagnosed with thrombophlebitis. A patient was recently diagnosed with thrombophlebitis 3 days ago. A patient was recently diagnosed with the thrombophlebitis 3 days ago. Now the patient suddenly complains of sharp stabbing chest pain. Now the patient suddenly complains of sharp stabbing chest pain. Sharp stabbing chest pain. What could be suspected for? What could be suspected for?
Patient complaint of
The patient was diagnosed with a thrombophlebitis 3 days ago. Patient was diagnosed with a thrombophlebitis 3 days ago. Now the patient suddenly complains of sharp stabbing chest pain. Sharp stabbing chest pain. Sharp stabbing chest pain. What could be suspected for? What you can suspect? What you will suspect? Tell me no.
Pulmonary embolism.
P. See, if you see clot history, then chest pain, definitely that question is what P. Clot history plus chest pain equal to P. Okay, shortcut run. Okay, so clot history, what all are the clot history? What are the other clotting disease? You tell me. DVT. DVT is a clotting history, right? DVT. DIC. Disseminated intravascular coagulation. Have you heard about this? DIC. Thrombophlebitis. Okay. These all are clotting disease, coronary artery disease. Okay. These all cases, if the patients have these history, then the patient reports chest pain, we can always suspect what pulmonary embolism. Clot history plus chest pain equal to P. Okay. So now we'll discuss how to manage DVT. What is the initial intervention for DVT? Okay. Any venous disorder of the leg. First action is foot and elevation. What is the initial intervention for DVT? Foot and elevation. Okay. I'll give you one trick. Okay. If a person is having any venous disorders of leg, you want to advise to elevate the leg, foot and elevation. But arterial disease means you want to advise for what? Leg dangling or dependent position. Venous disorder, leg up. Arterial disorder, leg down. Why? Arterial disorder, leg down to increase the gravity, thereby increasing the arterial perfusion. Venous return, venous disorder, why we are elevating the foot and to increase the venous return. Write this point. Just write for any venous disorders of the leg. For any venous disorder of the leg, foot and elevation is the best intervention. For any venous disorders of leg, foot and elevation is the best intervention. Foot and elevation is the best intervention. Foot and elevation are best intervention. For example, varicose vein, DVT, deep vein thrombosis, venous leg ulcer. These all cases what? First action is what? Foot and elevation. Because these all related to venous disorders. The venous disorders are. As you write, for any arterial disorders of leg. For any arterial disorders of leg. For any arterial disorders of leg. Leg dangling or dependent position. Leg dangling or dependent position. For any arterial disorders of leg. Leg dangling or dependent position. DPNDNT. dependent position. Leg dangling or dependent position, or walk as much as possible, or walk as much as possible, or walk as much as possible. Leg dangling or dependent position, or walk as much as possible. Okay. Some people may ask you, right? Sister, I am having leg pain. Can you suggest something? Okay. ചില ആൾക്കാർ ചോദിച്ചില്ലേ, sister, I am having leg pain. Can you tell some medicine or any suggestions from you? Most of the nurses, what you will tell? You tell me. നിങ്ങളെന്താ പറയാ? Morning you want to wake up, you walk too much. Don't suggest walking for every leg disease. Okay. If the patients have venous disorders, you want to at least don't walk too much. Venous disorder means they should not walk too much. In between, they want to take the rest with the foot and elevation. Venous disorder means. But if it is an arterial disorder means they want to walk too much. You understood? So, leg pain, there are various causes. Not only arterial disorder, venous disorder, that may be related to hypocalcemia, Achilles tendonitis, plantar fasciitis, rheumatoid arthritis, osteoarthritis, osteoporosis. There are various reasons behind what? Leg pain. First, you want to find out what is the problem, then only you want to suggest. Okay, leg pain causes are, there are various causes for leg pain. You want to find out what is the exact cause, then you want to suggest. Okay, don't think that for every leg pain, walking is best. Okay, don't think like that. Okay, so venous disorder means they should not walk too much. In between, they want to do what? Foot and elevation. Arterial disorder, they can walk too much. And leg dangling or dependent position. Is that clear? What are the examples of arterial disease? Arterial disorders of leg. You write examples. Examples of arterial disorders of legs are what? PAD, peripheral arterial disease. PAD, peripheral arterial disease. Peripheral arterial disease. Arterial leg ulcer. Arterial leg ulcer. Peripheral arterial disease. Arterial leg ulcer. Peripheral arterial disease, arterial leg ulcer. Okay. Then there are many other arterial disease, right? Like thromboangiitis obliterans or Burgers disease and Raynaud's disease and all. But no need, right? We will discuss in cardiology. Cardiology, okay. Thromboangiitis obliterans or Burgers disease and Raynaud's disease. This all comes under arterial disease of legs. We will discuss that in cardiology. Okay. So always you want to know arterial disease, what you want to do? Leg dangling or dependent position. Venous disorder means what? Foot and elevation. That is the trick. Okay. Next, we will discuss what are the other interventions. What all are the other interventions for DVT? DVT on the where and the key interventions. Tell me. The other interventions include elastic stockings. Why we are keeping elastic stockings? Elastic stockings to increase the venous return to the heart. Heart load venous return. What is the purpose of applying elastic stockings? To increase what? Venous return to the heart. Venous return kutana. To increase the venous return to the heart. Next, you want to keep the patient on pneumatic compression device. I'll show you what it is. Pneumatic compression device. So we want to keep the patient on pneumatic compression device. So what do you mean by pneumatic compression device? That's a special device which will increase the venous return. I'll just show you, okay? On a DVT pump, DVT pump. Same. See, this is what pneumatic compression device. Can you able to see that? 1 minute. Something happened. Wait for a minute. See, intermittent pneumatic compression device. We can clearly observe from the picture, this device will enhance the venous return. This will increase the venous return to the heart. So pneumatic compression device is mainly used for which condition? It is DVT, to increase what? Venous return. Okay. Next, a very important point. What is the prophylaxis for DVT? Prophylaxis for DVT is heparin sulfate. Prophylaxis. Prophylaxis means to prevent. Okay. To prevent DVT, what medication you want to give? That is heparin sulfate. Heparin sulfate. Okay. Heparin sulfate is the best drug of choice. So what is the prophylaxis for DVT? It is always heparin sulfate. Prophylaxis means what? To prevent. So while the patient is on heparin therapy, what lab value should be closely monitored? Just listen everyone. While the patient is on heparin therapy, what lab value should be closely monitored? Is it PTT or PT? PTT or PT? Okay. While the patient is on heparin therapy, what lab value should be? Okay. Okay. Some people are having confusion, right? Is it PT or PTT? Okay. See, whenever you get a question, patient is on heparin therapy, what lab value should be monitored? This is a question. Okay. What is the question? Patient is on heparin therapy, what lab value should be monitored? So take your 10 fingers and count heparin. Heparin. Just count it. Heparin count here. Heparin. How many fingers left here? 3 fingers, right? So PTT. Okay, heparin and 3 fingers are left here. So PTT. Okay, 3 letters are. Okay, PTT. So patient is on heparin therapy. What lab value should be monitored? 10 fingers and heparin count here. Heparin. 3 fingers left. Okay, so 3 letters. PTT. Okay, PTT and letters are PTT. Okay. So while the patient is on warfarin therapy, what lab value should be monitored? If you get a question, you just count warfarin. WARFARIN. 2 fingers left. So PT. Warfarin and 2 fingers are left. On a PT. While the patient is on heparin therapy, what? 3 fingers left. You understood this trick, everyone?
Yes, sir.
Okay. Okay. There is no room for confusion, right? So whenever you get this question, just count it. Okay. But always be sure that you are counting correctly. Okay. Some people they may count like this: HEPARINE. Heparin last letter is N. There is no E. If you count wrong, you will click PT. Okay. Heparin last letter is N. Okay. There is no E after that. Okay. So if you don't know about the heparin spelling, please look on to the screen. Screen നോക്കിയിട്ട് count ചെയ്യണം. Okay. So 3 fingers left means PTT. Okay. 2 fingers left means what? PT. So sometimes they may trap you. Patient is on coumadin therapy. Coumadin. Have you ever heard about coumadin? COUMADAN. Actually, what is coumadin? Coumadin is warfarin itself. Warfarin itself. Okay. What is the other name of warfarin? If you don't know, you write. Okay. The warfarin equal to coumadin. Warfarin equal to coumadin. 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 Patient is on coumadin therapy. What lab value should be monitored? You will count coumadin. No? Coumadin count is the letter. COUMADIN. And also 2 letters, 2 fingers. PT. Another BTN. Easy. So patient is on coumadin therapy, warfarin therapy. What value? PTN. PT. Along with the PT, always you want to assess what INR. PT INR ആണ് രണ്ടും നോക്കണം. Okay. So while the patient is on heparin therapy, you want to monitor PTT. Okay. While the patient is on warfarin therapy, PT and INR രണ്ടും നോക്കാം. Okay. So that's the point. So when we will use warfarin for a DVT patient, for a long-term treatment for DVT, warfarin or coumadin is the best drug of choice. Long-term treatment. But if you get a question, what is the prophylaxis for DVT means? It is always heparin sulfate. Prophylaxis is heparin. Long-term treatment for DVT is warfarin or coumadin therapy. That is the difference. Okay. So how to prevent DVT? The best way to prevent DVT is always early mobilization or leg exercise. Okay. Early mobilization or leg exercise. Early mobilization or leg exercise is the best way to prevent what? Deep vein thrombosis. Okay. I'm just asking you a general question. Okay. What is the purpose of early mobilization after any surgery? Just write early mobilization after surgery, underline. Early mobilization after any surgery. Early mobilization after any surgery, especially under GA, general anesthesia, especially under general anesthesia. Okay. Doctors will always try to mobilize the patient as soon as possible after any surgery under general anesthesia. Why? What may be the reason? Tell me, what are the reasons for early mobilization? One reason is to prevent DVT. One reason എന്തിനാണ്? To prevent DVT. First reason, you're right, to prevent DVT. What are the other reasons? You tell me, why the doctors are always trying to mobilize the patient as soon as possible after surgery?
Bowel sound.
No, not bowel sound. What are the
Stability.
other reasons? To prevent
Pulmonary
to
embolism.
pulmonary embolism. No, to prevent bed sore. Secondly, okay. If you are goes on keeping the patient in some position, what will happen? There's a chance for developing bed sore, right? Thirdly, to prevent respiratory complications. To prevent respiratory complications. To prevent respiratory complication. How mobilization will prevent respiratory complications? Tell me. See, when you are lying down, how your breathing will be? It is very slow. It is not forceful. But when you walk, what will happen? Your breathing force is very high, right? Force high. So it will prevent what? It will help to clear the airway. Airway clearance will help you. If you are lying down, what will happen? Secretion will build up there itself. It will increase the risk of pneumonia. Okay. So another reason is to prevent venous stones. To prevent venous stones. If you are not at all mobilizing the patient, some stones will be accumulated in the body. Okay. So mobilization will always enhance the what? Excretion of the small stones. Stones excrete ചെയ്യാൻ പറ്റും. Okay. This is the another reason why we are mobilizing the patient as soon as possible. Okay. So you understood this? Next topic we'll discuss about transmission-based precautions.